Brittany Nicole with Feast at the Table. And for all of those who are unfamiliar with what Feast at the Table is, it is a platform for Christians to come together and talk about hard conversations. And one of the hard conversations that we typically talk about is race. And it's all about racial reconciliation, us being able to have dinner. So that's where the Feast at the Table piece comes in. We will have dinner and we will talk about race and racial reconciliation. So I've been doing this for about a year so far, and we've been having some really awesome conversations. And in light of everything that's currently going on with the COVID-19 pandemic, I figured I would have Ms. Regine come on today and talk about how COVID-19 has been impacting the African American community, more specifically in regards to health. So she's just going to go ahead and start off with giving us a little bit of information about who she is and what she does, and we'll jump right in.
Okay, thank you for having me, Brittany. I really appreciate this opportunity to come on here and talk about something that's really passionate for me. I absolutely love public health in the Black community. So I'm a public health professional here in Cleveland, Ohio. I received my bachelor's in health promotion and education from the University of Cincinnati in 2016 with a certificate in minority health. I then took a year off and then decided to pursue my master's degree at Case Western Reserve University. While I was there, I was a mentor and I was a research assistant. Throughout my experience there, I was able to work on some awesome projects that really enhanced my love for public health. And then I was able to find my areas of interest, which are health equity, violence prevention, and infant mortality. Right now, I'm currently a health assistant at the Centers for Families and Children, where we focus on the health of children at our early learning centers from birth until kindergarten. We conduct screenings such as dental, blood pressure, anemia, vision, and hearing, just to make sure that there are no complications, no health complications, so the children are able to learn in their environment. We also collaborate with families to meet their health needs as well. And then in my spare time, I write for my blog titled The Public Health Notebook.
Awesome. And again, we're going to have her say the name of her blog because we want you all to jump onto that and see what she's also doing. And before we even started this conversation, I said we are going to have a candid conversation because we definitely believe that this is information that everyone needs to hear. So one of the things that I was really interested in hearing from Regine was, what does she see as an advocate? Like, far as her being an advocate in the Black community, why is that important to her?
So it's very important for me to be an advocate for the Black community because I feel that we were placed in situations where we've been unable to thrive. So because of these policies, procedures, and practices, that has had a lasting effect on Black health. And as an advocate, I feel like I'm able to help members of my community not suffer from things that are preventable, like infant mortality, violence prevention, and just have a better quality of life. And that's just really important for me.
Mm-hmm. That's awesome. I am not 100% privy on all of these discussions, and I shouldn't necessarily say discussions, but all of this information that you're going to bring. So one of the things that I wanted to know is just what is the history behind the health conditions that typically African Americans may endure?
So there's a lot that goes into the history of the African Americans, and the first thing that I want to highlight is the lack of information from research. So and when I say research, I mean like clinical trials, research studies, and like testing of new medications. African Americans have a very low participation rate in those areas. And since we're not able to, researchers are not able to research why these diseases and health issues are disproportionately affecting Blacks, it will kind of continue. And I did some research on my own, and I understand why, some African Americans are not really interested in those type of things. And things that I've come across is that America's had a very unethical history when it comes to medical research. So things such as the Tuskegee experiment, Henrietta Lacks, and even Dr. Marion Sims. So that's one reason why, that's one of the reasons why issues disproportionately affect Blacks. The other is actually racism. So even though race is a social construct, it has had lasting effects on Black health. It has affected members of every minority group. And so basically, just like Blacks who are actually qualified for jobs, they weren't able to get them, or they were shut out from seeking housing that they could actually afford, and that has had an impact on their health. So, and this is something that's actually not new to a lot of Black scholars. While doing some research, I found out that W.E.B. Du Bois actually spoke something about this, and I have the quote here. It says, he said, "The Negro death rate and sickness is largely related to conditions, so such as social and economic conditions, and not due to racial traits and tendencies." So not really due to how we carry ourselves, how we act, is due to the conditions that we were actually put in. Then he later states that with improved sanitary conditions, improved education, and better economic opportunities, the mortality of the race may and probably will steadily become normal. And I read this in The Health and Physique of the Negro African American. So that was pretty like eye-opening for me, for people to have been researching it so long, but it's finally become a thing. Like, race has a huge impact on our health. And then the last thing I want to talk about is the lack of public health funding. So even before COVID-19, the U.S. has been doing a terrible job with funding public health efforts, and public health funding focuses on prevention, preventing those diseases that cause death, preparedness. So when you actually, get a disease, you'll get the education and things like that, wellness and community recovery. So if there's low funding in these areas for health departments, schools, and other organizations such as Wesley Chapel, who are focusing on these things, they aren't really able to get the funding. And just another point, funding for public health is very different from funding of like regular health systems, like the regular medical system.
What I do find interesting that you did bring up was all of this has been researched for some time, but yet we are still in 2020 not seeing some of those, I guess, results that are needed to make sure that African Americans are getting the care that they need. I remember in college, when we were going through our social work courses, they were talking about how socioeconomically that impacts African Americans, and many people would think, oh, well, maybe it's just because, they don't want to go in and get checked for certain things. But when you're living in poverty and you don't live close to, I guess, big chain restaurants, and you are only going to the corner stores and they only have so much, they don't have certain produce there. So it's a lot really does tie into the race and where you're located and all of those things. So, I don't know. Yeah, it kind of upsets. I'm sorry. Go ahead.
Go ahead. I'm sorry.
No, I was going to say it kind of upsets me that we are still in this position in 2020 when all of this has been researched for a very long time. So I definitely thank you for what you're doing.
Oh, you're no problem. And even, I'm not sure about Cincinnati, but in Cleveland, there's been like redlining. So there's actually a map where you can see where African Americans were not able to get housing, and those areas are like Shaker now and Lyndhurst, things like South Euclid. The life expectancy in East Cleveland is around 50, and 5 miles up the road to Lyndhurst is about 82, I believe. Wow. So it's like you can just see that those disparities still exist from years past in the 1930s when they were actually implementing the redlining. So.
Wow. That's deep. That's deep. Wow.
It's kind of heavy on the heart.
Yeah. Can you talk a little bit more about some of those pre-existing conditions that maybe African Americans are dealing with, or pretty much that.
Okay. So some that we already know, breast cancer, but there's also infant mortality, asthma, heart disease, and stroke. And it's also important to note that even though these diseases are disproportionately affecting us, there's other diseases that are more severe for us. So the level of severity can can be affected by your race or ethnicity as well. And that's one of the reasons why I actually got into public health. My dad passed away from complications of sarcoidosis, and with that illness, it's more complex, more chronic, and more severe in African Americans. And when I did my research and I learned that, and I'm just thinking like, like how could that be? So then that's actually what sparked my interest in public health. And ever since then, I've just been trying to advocate for Black health and things like that. So
Thank you.
mhm.
I am looking at my notes right now. Can you speak to currently how this COVID-19 pandemic is not necessarily just affecting African Americans physically, but also mentally as well?
Oh, absolutely. So we all know that Blacks are overrepresented as essential workers. So that's putting them more at risk. And what I've seen is that the levels of anxiety has been really high. So the fear of the unknown. So we're feeling hopeless and helpless because this is new territory for public health officials, for governmental officials. No one really knows how to navigate these areas. So we're just getting statistics, we're getting stay-at-home orders, things that we're not used to getting, and it's like adding a lot of stress on us. And as African Americans, we have seen a decrease in our income, or we have members of our family or friends that are incarcerated, and we know that those rates of COVID-19 in the jails is very, very high. We may not be able to properly social distance if we live in apartment buildings or in highly populated populations. And then those of us who have underlying health conditions, that has also added a lot of stress. I know members of my family have been dealing with it really hard, trying to social distance, but still trying to live at the same time, but not, get COVID-19 because you have diabetes and, because you have heart disease or because you suffered a stroke two years ago. Mm-hmm. So, and even the physical health of people has been affected. The lack of disease management has come into talk lately because since like a lot of healthcare facilities have closed, they've transferred over to telehealth. And sometimes, people don't have the tech support, they don't have the devices, and 17% of the US don't have internet access. So it's hard for people to manage those conditions, those who have underlying conditions. And since if you don't have that internet access devices or tech support, you actually have to go into the healthcare facilities, which is putting you more at risk, more stress on healthcare workers. So it's kind of like,
Yeah.
a revolving door kind of.
It definitely hits home, of course, because I am African American, and you mentioned Wesley Chapel, and that is a place that I currently work at, and we're working in a neighborhood where majority of the people there are African American. So one of the things that we were really thinking about is that when COVID does hit this community, and it's a very dense population, like you said,
Right.
People are in apartments. How can you really social distance in that way when you're living in a 1-bedroom apartment and maybe you have 5 or 6 people? And I didn't, that didn't necessarily click in my mind immediately. But it just breaks my heart because, to be honest, when I am going to grocery stores and I'm going to certain places and I'm seeing the essential workers, they look like me. And it really speaks to the fact that you still have to go to work, even though this is going on. We don't necessarily all the times have the luxury not to go to work or the savings to do so. And it definitely does stem back to a lot of our social economic standards, not standards, but situations, I should say, excuse me. So when I heard this in the news that it was affecting us more proportionally than other races, and I heard a lot of people saying, why? And I got it. I understood why. So yeah, this is good. So I'm sorry. Go ahead.
We're saying, African Americans live in multi-generational homes and are the way we communicate with others, or how, like, our sense of family and friends, like we just kind of want to be social. But it's just like so many other ethnicities live in multi-generational homes, like Hispanics, Asians. A lot of people have that sense of family that they really cherish, and I don't think that should, should be out there for one of the reasons why we, are disproportionately affected by COVID-19.
I agree. I do. Can you speak a little bit more to what public health, what public health is saying right now about social distancing, just to make that really clear, because I know there are so many mixed just messages, and sometimes I'm confused about what I'm supposed to do.
Same. So it's new that, it's hard to adopt health behaviors in general. So, healthy eating, exercising, those health behaviors are very hard to adopt. And so has been social distancing and wearing masks. So just from my research as a student, when we talk about health behaviors, we kind of talk about, like, why is the person not, why are they not partaking in this health behavior when we've basically told them to do so. So what public health says, we have this health belief model, and it kind of speaks to why people are hesitant or not really taking the information that's given. And there are 6 components to it. The first is perceived susceptibility. So if you don't perceive that you will actually get the virus, you are less likely to social distance or, wear a mask or self-quarantine. So, like the media was saying, like, oh, African Americans can't get it, or or young people aren't dying from it, so the media has really impacted how we feel the susceptibility of getting COVID-19 has been. So, they're saying that, but then they tell us to stay home for 2 months. It's kind of like hard to perceive, and it's all like health behaviors is all about perception, how you perceive it. So the second is perceived severity. So if I do get COVID-19, what are the symptoms going to be? It's like the flu. They say it's going to be mild symptoms, but of course some people are dying, but that's because they're older. So it's like that's really important. The perceived severity of actually, what the effects of COVID-19 will be. And then we have perceived benefits. So is it actually beneficial to me to social distance? Is social distancing going to stop me from getting COVID-19? You know what I'm saying? So if they don't believe that there's direct benefits from adhering to this health behavior, people are less likely to do it. The next one is perceived barriers. So the barriers refer to obstacles a person believes may prohibit the adoption of the recommendation. So what barriers are put in place for me to actually not be able to social distance? A lot of people being in a household, I actually still have to go to work where social distancing is kind of hard to do. So those barriers outweigh an individual actually being able to social distance. And then we have cue to action. And recently, cue to action has been someone that a person knows who has gotten it. So if you know someone who has gotten COVID-19, if they've had, severe complications, you're more likely to social distance, wear a mask, self-quarantine. So, and then the last one is self-efficacy. If you feel like you will be successful in actually adhering to these health advancements, then you'll be more likely to do it. So it's all about, it's like those 6 things, which are kind of hard to, it varies for everyone, kind of. If you're in a situation where, and you're already on the fence about social distancing, yeah, it's a lot to digest. I know that was a lot. I know I said a lot. I'm sorry.
No, it was good though, but it is. I mean, the reality of it is, like, this is a lot. Half of the time, I don't know what to do.
Exactly.
And I'm sitting at home like, should I go out to the grocery store? I'm hungry, but I'm nervous, and so I get it. I definitely get it. And for the first point, can you read the first point that you made again?
Perceived susceptibility.
Yeah, I mean, just to be honest, when I was looking on social media, and I'm just like, why are we having block parties? Why are we having house parties? Like, no. But when
Yeah.
you don't think this can happen to you, um, you know, the mindset will make you feel that you are
Your
invincible.
everyday life, yeah.
Yeah,
And,
yes.
and we've seen that it's a lot of Generation Z and baby boomers who are kind of like not really feeling like they'll actually get the coronavirus. I think I've seen that young people are more likely to contract COVID-19,
Wow.
but older people are more likely to pass away from complications of COVID-19.
Gotcha. Okay.
Now, even within my own friend group, I have about 5 friends who actually had confirmed cases of COVID-19. So
No.
even with me being a public health professional, I tried to scare them into social distancing. I've tried to educate them into social distancing. And it's just like, they didn't really perceive it as a threat or, understand the importance of social distancing. And also, I don't know if me living with a grandparent was one of the reasons why I was kind of big on, staying away from those who may have been in contact with someone who had a confirmed case. Because I would, hate to put my grandmother in a situation like that. So
Yeah.
that was probably be a cue to action for me.
Mm-hmm. And I had a conversation with my brother about this and my mom as well. And they were just like, well, I don't get it. I see people on social media who are with their families. It looks like they're still having a good time. And I said, well, I think it's more than that. And also when you are in a place where maybe you don't have to go out for groceries for a couple of months because you have the money, the income to do that. Maybe they're not leaving the house as much as you think they are. Maybe they're social distancing. They really are able to stay in the house and no one's going back and forth to work. And I think sometimes what we're seeing is mixed messages, which tells us, well, you can still live your best life and be out there and come back home. But again, it's when you said perception, I really never thought about that. Like, wow, it does come down to perception. So thank you for saying that. That was good.
You also never know what the people they've been interacting with has been doing. So if like I still go to the park with my mom, but I know my mom has been taking measures to stay healthy and stay safe. So I feel fine with interacting with her, but I won't necessarily interact with a friend who I'm not really sure what their has been, like how they perceive COVID-19 or if they actually have COVID-19, because the symptoms can be asymptomatic. So you really have to just have that open communication. That's really important. If you really need to, if you're social distancing and self-quarantining alone and you need that human interaction, it's best that you have that conversation with someone to see what they've been doing, to see, maybe this will be a good person that I can interact with, and we'll just keep it to each other.
Mm-hmm. That's good. That's smart.
Yeah.
Good tip. So I know in the beginning of the conversation, we did talk about some of those common barriers that African Americans face. Mm-hmm. Can you speak to what is currently been doing to address some of those things?
So I've actually worked on a project at Case that really has impacted implicit biases. And I think that's one of the hurdles that we're going to have to get over so that African Americans can have a pleasant experience in the healthcare system, because implicit biases, they exist through across all spectrums of the healthcare system. It's been shown that.
I'm sorry. Can you explain what that is for some people who may not know what an implicit biases is?
It's basically like something you don't know that you're doing. Like, it's, for lack of better words, feeling some type of way towards someone that for no reason or based just upon their race without even knowing them.
Gotcha.
Yeah. So we see that a lot in the healthcare system, and that's one of the barriers for African Americans in the healthcare system. So research indicates that across every type of like diagnostics, treatments, and things like that, Blacks and other minorities receive fewer procedures and have a poorer quality of medical care with whites. So than their white counterparts, I'm sorry. So at Case, I worked on a project where we created a virtual reality experience. A group of us came together and we created this experience for doctors to understand what African Americans are experiencing in their neighborhoods, in their homes, and just things like that. And also like basic implicit bias training, patient-centered training, and just understand what racial equity is really important for healthcare providers, so that African Americans can have a good experience and an effective experience with physicians.
Mm-hmm.
Did that answer your question? I'm sorry.
No, it answered it.
Okay.
That is good. See, I keep pulling examples from TV. See how much I watch TV. I was watching what was it called? Something American something with a young man, and he played football.
He played football. Yeah, my friend keeps trying to get me to watch that show, but she's like, they're so cute on there. I'm like, okay,
well, it is. Well, he ended up getting injured, and they didn't know much about him. He went to the hospital, and they thought that he was, in their minds, a quote-unquote typical Black kid, of whatever that actually looks like or means.
Right.
So that was one of their implicit biases. And he was telling them, I am in pain. I'm not, I'm really not feeling well. However, the doctors were not listening to him. And I just wonder how often that happens when someone who is African American comes in and says, these are the symptoms that I'm facing, and they're not being listened to. So it comes down to some of those implicit biases, because I do remember being told that sometimes back in the day, doctors thought that African Americans had a heightened level of pain threshold. Right. And it's interesting how that continues to happen today, to where we won't get the medications that we need, or we won't, we're not necessarily listened to because of some of those implicit biases. And also, they thought that this young man who was sick was a thug. Maybe he got shot for a certain reason, and found out later that he was a scholar. That's what happened. He actually got shot. So it's just interesting how those implicit biases play through, when in all actuality, that may not be the case at all.
Yeah, they are very prominent. I'm not sure if you heard about Serena Williams when she was giving birth.
Yeah.
How she was constantly telling her physician, hey, I'm in pain. And, come to find out she had other complications from childbirth, and she felt like she was not being listened. And that's actually one of the reasons why infant mortality is so high in Cleveland now. There's like they're doing like interviews with patients to understand like their journey as soon as they walk through the door. They're trying to stop this from like as soon as they have their first initial appointment, when they say they're pregnant. And there's a lot of efforts being done in Cleveland around implicit biases and infant mortality. The three big hospitals here, Cleveland Clinic, UH, and Metro, they have all teamed together. They have like created a video for their employees to know, so they know that this is something that is very important to us, and they have like ongoing training. So it's being done, but it's taking some time to be done. Like it has to be a coalition made and things like that before before the appropriate efforts can be made towards these preventable causes.
Wow. Well, it sounds like you're doing some good work nonetheless. Absolutely. With all that we have said, and we know that there are common barriers, what can we do in order to advocate for ourselves within the healthcare system?
That's a great question. That's one of the most important things about this conversation, and this is very important to me because this is something I faced in the healthcare system, and I got advice from physicians and friends of mine, and I've kind of gathered all that information and put it into this answer. And so the first one I would say is to take someone along with you to your appointments. So it's hard to be an advocate and a patient at the same time. It's hard to advocate for your health and also, be a patient and, have an operation done, or, have something done when you're trying to explain things. So personally, I bring my mom with me. She asks all the questions, like questions that I don't even think about. And you don't have to have a level of education. Like if you just have a question, you should answer. And that's number two. You should really feel comfortable with asking questions. If you do not want to leave the doctor's office with anything unknown, you don't want to have to go to mayoclinic.com or, WebMD to get something when you've left a doctor's appointment. The third thing is, I would say, doctor shop in a good way. Ask around, see what their specialties are, what boards they sit on, to make sure that make sure that you feel like you'll be respected and you'll be heard. Ask friends or family members, where they go, what they like or dislike about their physician, and make sure you interview your physician as well. That's really important.
What would some questions be if I were to interview my own physician? What would that look like?
Where'd you get your medical school degree from? How many years have you been practicing? What past hospitals have you worked at? How do you feel about this? Or even probably give them an example of whatever, if you're experiencing anything, tell them about it and just kind of see how that conversation goes. I had a consultation with my physician before I even went into the office. So, and just being a Black woman, I know about infant mortality, how it's about race. It's not about education status, socioeconomic status or anything about that. So that's why I took it upon myself to actually have a physician who I feel comfortable with, who I feel will actually listen to me. And I really appreciate her. Like, we're like besties.
That's good. That's good. I'm learning stuff, so that's awesome. We are about at the end of the interview. However, are there any additional resources that you would like to let us know of?
I would definitely say if you see a problem in your own health or in your community's health, reach out to local nonprofits. There are a ton of local nonprofit organizations who are probably tackling the same thing that you're interested in or that you see the need to be taken care of in your community or in your personal life. And then you could also possibly volunteer and then become a community liaison. Those relationships between community members and local organizations are really vital in public health, and it's something that it's hard to sustain public health programs without community members as leaders or as them being involved. Because as a public health professional, we tend to come into a community and fix a community without getting input from the community.
Yeah.
So it's really important. Like if you're passionate about something, like I'm passionate about violence prevention, I volunteer the Violence Prevention Coalition, to bridge those gaps to actually see a change. It's important to get involved instead of just sitting there. But because I've been volunteering, but even if like with work, I volunteer at different organizations. It's just really important to get involved if you want to see a change.
Amen. Amen. Seriously, yes. Because we can sit down, we can complain about all of this, but at the end of the day, what are you doing?
Right.
So yeah. Thank you. Thank you. Thank you. I have learned from this. I really do pray that people take so much from this because I think this was an awesome conversation. Can you tell us again the website that you have so people can check that out as well?
Yep, it's called the Public Health Notebook. It is my way of using my own personal health experiences through a public health lens to kind of educate, advocate, and just communicate effectively with community members. I try to post at least once a month. My new post is for Mental Health Month, which is May. I will have that out in about 2 weeks, and I'm going to actually talk about how COVID-19 is affecting the Black community's mental health. So.
Awesome. Good stuff. All right. Well, again, thank you very much. I'm just going to give a couple of closing announcements. So this is something that I want to continue to do on at least a monthly basis where I am having these type of discussions because I definitely think that they are helpful and very educational. So if you are interested in either telling your story in regards to racial reconciliation, or let's say like Regime, you're a professional and there is some information that you would like to give us, please do contact me. And I will actually have a little blurb in regards to the conversations that I am looking to have. So that information will be posted on my site, well, Facebook page, and it is Feast at the Table. And also, if you want to contact me via email, it is feastatthetable@gmail.com. So I'm just going to go ahead and close out with prayer because that's what I do.
Okay.
and
You know,
we're going to do it. All right. Father, in the name of Jesus, I just want to thank you for this conversation. I want to thank you, Father, for the things that were said today. And I just pray that you will continue to bless Regime and all of the work that she's doing, because it is a great work. And I not only pray for the African American community during this time, because I know that so many people are affected. So I'm praying for us all, Lord, that you will continue to show up in amazing ways, Father. But I definitely do pray that your justice will reign for those who are being underserved, and for those who have within the health system been historically disproportionate. I pray, Father, that there will be justice in that. And I do pray, Father, that there will be advances for those who are suffering. But again, I thank you for the work that is currently been done. And I just really pray, Father, that wherever wrongs there is, that it will be righted. If that is a word, be righted. But you know what I'm saying, Lord. But I definitely just pray for your justice. And I pray, Father, that you continue to watch over this particular community and all of those who are being affected by this. And I just pray that you would give us wisdom and just the understanding of how to best care for our bodies and our minds during this time. So I thank you for all that you do in Jesus' name. Amen.
Amen.